About 60 to 70% of senior citizens in the community are suffering from terminal knee pain, and that's due to advanced osteoarthritis or rheumatoid arthritis of the knee. I have seen so many patients who are afraid of the surgery more than the disease itself, and it is really astonishing. So I think it is absolute a duty of doctors like us to take this knowledge to the patients, telling them how effective and how safe the knee surgery is going to be. The knee replacement in a couple of years back involved a lot of dissection, lot of intervention. We had to put a lot of, today with the old method, we had to use big implants and big rods. So I'm going to just show that earlier surgery, the old method, involved putting rods like this and cutting this. So it was definitely a bit of a complex thing for elderly people. Also, it was slightly risky. But today now, with the use of computers in the surgery, navigation, the alignment devices like ortholine, and the newest technique, that is robotics, this has now become just a surface replacement. So you don't have to cut ligaments like cruciate ligament, posterior cruciate ligament. You don't have to enter the medullary canal or the inside of the bone, because if you enter inside the bone, there are chances of embolism. There are huge chances that your heart or the cardiovascular system gets loaded or it gets strained. But today what we do is we just actually during surgery we remove this diseased cartilage and just replace it. So it becomes like a resurfacing option. So if you see this, then during the robotic surgery, what we do is we have sensors and handheld devices like this, and as we go on moving this, the computer records the actual mapping of this entire femoral condyle, and that is created there. It notes how much the condyles are damaged, how much actually is the deformity in that. We also can take the leg through the range of movement, so we know not only the static imaging but also the kinematic imaging or kinetic imaging and biomechanics of the knee joint. After that is done, then with robotic surgery, we correct the ligaments, balance the ligaments also, and then we just have to put this sort of cushion in between. And if you see here, we don't have to enter the bone. We can just shave off or smoothen this bone with very high speed burrs, like the burrs which are used by dentists, and just take off the diseased portion of the bone. So in my experience, now earlier technique we had to remove almost 10 millimeters of bone from all directions. Now with burring, it's enough to just burr off 2 to 3 millimeters of bone, and don't have to actually enter the medullary canal, which is of a great advantage to the patients. So we put this cap there and we put this cushion here. So that is how the knee is constructed. The bend of the knee is also corrected to the absolute accuracy, and due to this sort of least invasive treatment, a patient is able to be mobilized immediately. We can also just replace the damaged portion. Means this is a total knee with a implant, but we can just replace. You can see that only one part of the joint is replaced. So many patients who have only one part of the joint which is damaged, you can just replace it, preserving all the natural structures, the ligaments and everything. So I think today, to summarize, the knee surgery has become very specific. Yes, but you have to actually have the technology like robotics to get it precise. Otherwise, there is no point in just going on removing the bone like we used to do 30 years back. And today you can just preserve all the normal ligaments, all the normal structures with the help of this technology of robotics. And then patients, especially the elderly patients, and majority of my patients are senior citizens with some problems like many patients have comorbidities like diabetes, blood pressure, they have thyroid problems, they are obese sometimes, they are all many of them have cardiac surgeries being done. So all these patients, they are immensely benefited because they are slightly risky patients, high risk patients. So these patients also do extremely well after this least invasive robotic surgery procedure. So in my opinion, the technology has gone a long way, and my general advice to the patients is that they should definitely be a bit careful about the disease also, and don't be afraid of treatment, because the treatment and the knee replacement surgery with the help of robotics has taken huge leap in reducing the post-operative, intraoperative cutting of the tissues, post-operative pain. Patients are able to walk immediately, same or next day, and they are discharged within 2 days. So they need not be afraid of all these knee replacement surgeries. And millions of surgeries are done in the world annually. So they are absolutely, in my opinion, one of the greatest sort of advances in medical science is knee replacement with the help of robotics and computer assisted surgeries.